When looking at patients with relapsed refractory acute myeloid leukemia, these patients remain to have not good outcome of their therapy. There are very limited therapy options for these patients, particularly after failure of allogeneic transplantation. And one therapy concept that has been used in the past actually is the use of immune checkpoint inhibitors. Immune checkpoint inhibitors have been approved for hematologic malignancies, for example, primary mediastinal large B-cell lymphoma or Hodgkin lymphoma. But when it comes to acute myeloid leukemia, the effects of checkpoint inhibition have not been as strikingly as they have been for these lymphomas, for example. There have been clinical trials that used one checkpoint inhibitor, for example, Nivolumab, in combination with chemotherapy, hypomethylating chemotherapy to be exact, and they showed in comparison to a historical cohort that this might improve the outcomes, but the effects weren't that big. So what we're doing with the AARON trial is that we're performing checkpoint inhibitor plus hypomethylating agent-based therapy, but the difference to what I've talked about before is that we use two different checkpoint inhibitors. The one is again Nivolumab, but the second one is called Relatlimab, which is a checkpoint inhibitor that targets the checkpoint LAG3. This molecule has been approved for the treatment of patients with malignant melanoma just a few months ago, actually, and has shown to have superior efficacy compared to Nivolumab alone. And we're trying to use that combination checkpoint inhibitor therapy in combination with hypomethylating agents to improve outcomes for patients with relapsed refractory AML. We've enrolled 10 patients so far into the trial and do see some optimistic outcomes, but the trial is ongoing and still enrolling patients.